All right, hello. My name is Kendra Mickens, and I am doing my physical assessment checkoff for week 5. And I have Tanisha Cartledge here. And I have to ask you, do I have your permission to record live for it to be submitted? Thank you. And then I do have my 3 cards here that I have, but since it shows up backwards, I will send these to you tonight. And I will actually sit these 3, put these back in order, right over here. And I believe the other part was to show you the room we're in. So I'm just going to spin this around, and you can see it is just me and Miss Cartledge and some dummies in the room. And nothing or no one else. So, and you are actually on my webcam on my laptop. So I'm hoping that got all of the room. And we are going to start our head to toe assessment. Well, my name is Kendra, and I'll be performing your assessment today. Can you start off by telling me your first and last name?
First name Tanisha.
Okay. Do you know what today's date is?
Yes, today's date is October 28th.
And do you know where you're located?
I'm located in Charlotte, North Carolina, CPI University.
Okay. And in doing my assessment with Miss Tanisha, I will also note that she has a normal affect. In starting the head to toe assessment, we do start with the head. With that, I look at her hair. I also look at general appearance. I can also, and I have washed my hands. Let me throw that in there. I did wash my hands. So I start with feeling her scalp and feeling to see if I feel any abnormalities there. And I will get her to actually face the camera. And one of the things that I will be looking for when I'm facing this way is actually looking for symmetry of her face. I am going to have her remove her glasses for parts of this head to toe assessment. So some of the things I'm going to do as I face Miss Tanisha, Miss Cartledge here, is I'm looking and her eyes and face seem symmetric and her nose is midline on her face, just above her mouth, which I would find normal. And then I can also look at her ears, which also line up with the outer canthus of her eyes, which is all normal. Also, while I'm working on her face, some of the things we're going to look for is checking her facial muscles. So I'm also going to go ahead as I get ready to start into her eye assessment is look at her eyebrows, which are well groomed. And I see her eyelashes as well. And some of these things I'll get her to also repeat after I get her to kind of lay in the bed. And have her actually do a couple of facial exercises for us. But while she's sitting here in this position, I'm going to go ahead and I'm also looking at her neck. And as I look at her neck, I'm looking to see if her thyroid appears enlarged. And her thyroid does not appear enlarged, but I am going to actually palpate. And do you have any difficulty swallowing? I've talked about your eyesight, and I see you wear glasses.
Yes.
So what is your vision?
I'm not sure about it. I know that.
All right, so she knows she is nearsighted. So what I'm going to do is actually walk around the back here. And I'm actually going to come around as I'm palpating for her thyroid just below the cricoid cartilage. And if you could swallow for me. All right, any difficulty swallowing? And I'm just trying to palpate her thyroid gland, which should be just below that area. All right. In the assessment from this area, I am going to also move to listening to her heart, listening to some of her respiratory sounds, and then listening to the posterior area. Once I have her lie in the bed, I'm going to have you be able to see some of the assessment for facial movement, things of that nature. So, actually, while we're still on the head, as we've talked about the ears, we can also assess the ears, and I'm going to perform 2 different tests. One is going to be Weber, both using 2 different tuning forks, and the other one is going to be the Ren or the Renee, or Rena, I should say. Um, with these two different tests, again, we're both assessing for hearing, but it's going to be a little different. One of the things we can do in assessing the ears, and for ear assessment, typically we're going to actually pull the auricle up. Now, have you had any difficulty hearing? No. Any ear infections, ear aches, any tenderness when I touch here? So we would like to also assess for any tenderness before we want to look into performing ear assessment. And so pulling up the auricle is just going to allow us to straighten out the canal. And I don't see any excessive buildup. It looks nice and clear in there. And then we can come over here and repeat the same thing with the other ear. And I'm just going to palpate any tenderness. And I'm going to straighten out this one as well. Looks good as well. All right, nice curly eardrums in there. Something else we can perform in this assessment and just looking at Ms. Cartledge's face is we can also check for lymph nodes. And as we're looking for lymph nodes and glands, we have the preauricular glands right in front of her ear and postauricular glands right behind. You have the occipital gland toward the back of the head or toward the occiput. You also have tonsillar glands right below her mandible. And then you have the supraclavicular glands that are going to be right here above her clavicle. Some other things while I'm looking at her head that we can also assess while we're up here is she also has her carotid arteries. So for these, we're actually going to palpate these and we're going to auscultate them. With the carotid arteries, we actually palpate these one at a time. As I move through the rest of the assessment, a lot of times we're going to be checking the pulses at the same time just to assess to see if the strength is the same on the other side. But for carotid artery, since we could cause syncope, and we don't want to do that to Ms. Cartledge, I'm going to actually assess her carotid artery one at a time. And I would say that is a 2+, which is normal, and a 2+, which is normal. And with our book, it tells us that we can assess for bruit and actually suggests listening for the bruit or auscultating with our diaphragm. And hold your breath for me. All right, and you can breathe out and hold your breath for me. And you can breathe out. And in listening, I did not hear any bruits at this time. So, still dealing with Ms. Cartledge's head, I'm going to go ahead and perform the Weber test. Excuse me. The Weber test for hearing is actually going to test to see if Ms. Cartledge can hear bilaterally at the same time. Excuse me. So one of the things we can do is we can actually place the tuning fork in one of two areas for this one. So it can either be placed at the top of her head, and she should be able to hear the sounds bilaterally at the same time, or it can be placed in the middle of her forehead, and again, the sound should be heard equally at the same time. So I'm just going to strike it. Do you hear it more on one side, or do you hear it on both sides equally? Both sides equally, which is normal. We like that. Now, the second hearing test I'm going to do, the RENA, is actually going to do a comparison of bone conduction versus air conduction. So I'm actually going to get you to hold your here, back here. Just hold it back. And in this one, I'm actually just going to place the tuning fork back on her mandible here, and we're going to see what we hear. What I'm going to have you do is I'm going to strike the tuning fork, and I'm going to place it back here, and let me know when you stop hearing the sound. Gotta get a good sound. And with this test, as you can see, she actually heard air conduction longer than bone conduction, which is actually normal. All right. Again, we are going to revisit some things just so Ms. Cartledge can face the camera for you. But again, some of the things that I've noticed, again, her eyebrows, her eyelashes. I'm actually going to have you open your mouth for me. And I'm actually looking at her tongue, and I'm looking at her mucosa, which is pink and normal. And if, actually, I'm going to grab my tongue blade here. We're going to look at Ms. Cartledge's tonsils and pharynx area. And this is brand new, right out of the package here. All right, so I'll have you stick your tongue out for me and go, ah. All right, then I'm actually going to look with my light again. All right. And one more time, stick your tongue out and go, ah. There we go. All right, I'm not trying to elicit her gag reflex, but her tongue is normal, good and pink, as I said, with her mucosa. And it looks like she still has her tonsils from what I can see, but they don't look enlarged. So I'll ask, Ms. Cartledge, have you had a sore throat? Any irritation? No sore throat, no irritation. And again, another thing we can assess while we're assessing her throat, again, as I talked about those tonsillar lymph nodes early, again, a lot of times when people are not feeling well or sick or coming down fighting something as a part of that lymph system, we can again assess for those lymph nodes, which right now Ms. Cartledge does not have any that are enlarged. Ms. Cartledge, I'm actually going to ask you to stick your tongue out one more time. So she is able to stick her tongue out, and if you could lift your tongue up. And she is also able, if you could turn there, and show them that she is also able to lift her tongue up. Can you move your tongue side to side? She can also move her tongue side to side. And again, also with doing that, again, looking at the mucosa, looking at everything to see if everything appears normal, pink, not beefy, red. Also making sure that I don't see any signs or symptoms of pallor. So everything looks good and pink there. Now, actually, while you're sitting here, I have you face them. And actually, if you could lift your eyebrows up. All right. And if you could blink really hard. And I'm just going to see if I can open. Nope. So good muscle there. And then if you can smile for me. And if you can frown. And if you could puff out your cheeks. Very good. All right. So also, while I have Ms. Cartledge here, I'm going to also check to see neck movement. So a little range of motion. So again, then you heard left, perfect, left and right. Can you go up and down? Up and down. So I see very good range of motion there with the movement of her head and neck. Any pain in your head and neck? Any stiffness? Any difficulty in moving your neck? No. No. So actually now I'm going to actually move on to, in this position again, I'm going to go ahead and listen to her heart. There are a couple of different areas where we can listen. She has a pulmonic area, aortic area that's going to be on the right side, and the other points that we listen to are going to be on her left side. We're going to listen to the aortic, and then the pulmonic, and we're going to listen to Irv's point. We're going to listen to the tricuspid, and then we're also going to listen to the mitral area. When we're doing this part of the assessment and assessing the heart, typically with the heart and listening for the apical pulse, we also like to assess PMI, or point of maximal impulse, which is typically going to be mid-clavicular, fifth intercostal space, which just actually happens to be the location of the mitral valve area as well. So for Ms. Cartledge, I'm going to have to get her to assist me a little bit because she's going to have to actually lift up her left breast. And with lifting up her left breast, again, we come midline, and it is also an area that we can palpate, where you can feel for PMI. It is actually a palpable pulse as well. And typically, a lot of times we'll listen with the diaphragm first. And again, as we're listening, typically for apical pulse, you can listen for a full minute. But you're listening again at this point of maximal impulse, typically with the diaphragm. And then again, we would go about the second intercostal space, and we would listen in the aortic area. And then we would also listen in the pulmonic area. We can come down to about the third and listen to the tricuspid area. Prior to that is Erb's point. Just below that, again, is going to be the tricuspid area. And then the mitral area is, again, also the same place as PMI. Also, when you're dealing with the cardiovascular system, we can assess for jugular vein distension, but typically it's something that we can assess as long as she's at least 30 degrees elevated. So we'll come back to that once she's laying down in the bed. As we're dealing with pulses, we also have the radial pulses that, brachial pulses that are here, and then radial pulses that are here. We'll have the femoral pulses that'll be behind her legs that we'll see a little bit when she's laying back. And then you have the dorsalis pedis, and then you have the posterior tibialis, which is going to be on the inside of each foot. And hopefully, I think we have the bed adjusted so you'll be able to see that as well. Oh, we're just going to go ahead. While we're here, we're going to go ahead and listen to her breath sound. So different resources, a lot of times we can do at least 5 areas bilaterally on the front, sometimes more. And we're listening again for those vesicular sounds and bronchovesicular sounds, bronchial sounds higher up. So what I'm going to do is I'm going to have Ms. Cartledge fully inhale and exhale, and then I'm going to take a listen, and then prior to moving, I'll make sure that she has done a full inhalation and exhalation. So I'll have you take a deep breath for me. And of course, with women, sometimes it's a little bit more difficult, so I'm going to get Ms. Cartledge's help again, and we kind of just place the breast tissue. And on the front, we can come out to those lateral areas as well. Okay. Now, I'm going to move around to the back. And on the back, there are going to be more areas to assess the lungs, but we're going to actually repeat similar to what we did on the front. I'm going to have Ms. Cartledge inhale and exhale, and I'm going to listen here over the back. All right. Now, one of the things we do is, of course, we typically start off with inspection and looking at the overall shape, although I've already auscultated. And we look, and what I'll do is have Ms. Cartledge take a deep breath. And again, I'm looking for symmetry of how she inhales and exhales. Okay. And Ms. Cartledge, I'm just going to place my hands over your back rib cage area here. And I'm going to have you inhale and exhale one more time. And again, we're palpating for symmetry when she inhales and exhales. In this area, we can also assess for tactile firmness. So I'm actually just going to have you say 99. 99. 99. Okay. Now, when we're listening to the lungs, once I move down to the abdominal region, you'll notice that this is also an area that we can percuss. So typically we can percuss over this area, which should have a resonant sound when we're percussing. It's typically easier to percuss over skin, but we're going to respect Ms. Cartledge's privacy. But again, you would hear typically a resonant sound. Also, you could do percussion over the front. Again, just by striking your dorsal finger, and you should still, again, be able to hear the difference in sounds over the long fields. All right, I'm going to actually have Miss Cartledge recline in the bed here. And I'll lift the head of the bed up a little bit. This is one of those beds that turns you into a little bit of a sandwich. Yeah. All right, still comfortable?
Yes.
All righty. And we're going to move along here to perform an abdominal assessment. Typically, our four quadrants. Typically, we start in the right lower quadrant, and we'll move our way up and around. And we're actually going to actually inspect first. So I'll get her a little bit more privacy here. So we have some privacy here as we get ready to inspect her abdomen, the right lower quadrant. And when we look at her abdomen, again, I'm looking to see if it appears non-distended, if it appears gravid. And actually, this is one of those assessment areas where we inspect and then we actually auscultate, so it all sounds that aren't really there. So I have looked, and I'm going to actually listen, start in the right lower quadrant. All right, I'm going to move up here. And I'm moving along in each quadrant as I hear vowel sounds. So sometimes it's going to be quicker in some areas, sometimes it's going to be a little bit longer. All right, and now that I've auscultated, it is safe to go ahead and percuss and palpate. So again, similar to how I percussed over the back, you can actually percuss over the abdominal region as well. However, the sound should be a little bit different. Now I'm going to be listening for more of a timpani sound as I move over her abdomen, but I will be looking for her liver, which should give me more of a dull percussion sound. And should be able to hear the change as I percuss and be able to tell where those borders. And as I move up, you can hear it different. Again, right here in the right upper quadrant area was a different sound as you move toward the borders of her liver. Now I'll actually palpate. Do you feel any pain? Any difficulty going to the bathroom? None. Any issues with voiding? None. So what I'll do is also take this time, kind of while we're still in the upper region, since we're not actually performing a breast assessment, I will talk to Ms. Cartledge about a breast assessment. Typically, what we could do is there are a couple of different ways to perform the breast assessment. You could either do the wedge method, where you actually are feeling the breast tissue. You turn it almost into a circle, and you divide it into wedges, and you make sure that you palpate each area. Some people can take to moving up and down their breasts. One of the important things to do is to make sure that you want to go all the way to the top, right up under your armpits. There are a lot of glands up under there, notes, things of that nature. Such as doing a self-breast exam to make sure that you don't have a lump of some sort. Sometimes we forget to check up under our armpits, where women can also get breast cancer because that tissue does extend there. So you want to make sure that you go all the way up under your arm. So I'll have you lift up your arm there. You want to go from the breast tissue up under your arm to make sure that you are palpating all of that area. And you can lower your arm. And then typically when we look at a breast assessment, we also, when talking about a self-breast exam, we say to remember to do it after your monthly cycle. A lot of times right before your cycle, you will have normal breast changes anyway. So we don't want to do it right before the cycle starts because you may feel some things that are slightly abnormal to you, but are just your regular breast changes before your cycle starts. For some women, whether it be menopause or whether they're on a birth control pill, where they don't have a cycle, some will say if you know you routinely don't have a cycle, you can pick a particular day of the month, maybe your birthday, to remember to always do that monthly self-breast exam. So there are a couple of things that you can do to make sure that you are checking your breast. Also with the breast, we also like to assess for the nipples. So have you had any abnormal leaking? And so again, those are just some things that we like to check for. So it's breast and nipples, how they look. Also, if there were any abnormal dimpling of the breast, things of that nature. Those are the things that will stick out, even if there weren't a lump felt. If you have some abnormal dimpling, that's something that you will want to bring to the attention of your doctor. So again, we're going to move on down. We've kind of covered the face, head, neck region. We've covered the breast, chest, lungs. We've listened to the heart. We've talked about some of the pulses, brachial and radial. We've also done the carotid. We're going to move on down a little bit more into the lower extremities here. And again, I'm going to raise this cartilage up a little bit. Just so you all can see a little bit better. There we go. So now one of the things that we can assess for is again continuing with the pulses. If she has a popliteal pulse, which relax your leg, it's just going to be right behind her knee area, and we can palpate that there, and then actually palpate that there. And then once you get to the foot region, the dorsalis pedis is going to be located right at the top of her foot. And they are both strong. So I don't know if you can see there, a little bit there. And then the posterior tibialis, you're actually going to come to the inside of her foot, going back toward her ankle. And I would say that all of her pulses are 2+. Now, some other things that we can do is we can assess also for her reflexes. So I'm just going to elevate her leg ever so slightly there and have her relax. And, all right, 2+ reflex there. All right, and I'm just going to support this one and relax. And we have a 2+ there. Now I'm going to have you take your foot and just cross it slightly over your right leg. There. All right, and just relax. All right. And then you're going to do just the opposite. All right, here we go. All right, and that's just checking both her patella and then also her Achilles reflexes there, which were both 2+, which is also normal, similar to her reflexes, similar to her pulses, and you can relax there. One of the catch-alls that I do when doing a head-to-toe assessment is to still get things for grips, movement. It's going to be some of the pulses that we've already done. It's going to be assessing for edema, temperature, capillary refill, and color. So for all those things, another sister program came up with Good Morning Students, Please Eat the Chocolate Cake. So again, with looking at that, that's going to be grips, movement, sensation, which I left off, excuse me. So Good Morning Students, Please Eat the Chocolate Cake, grips, movement, sensation, edema, temperature, capillary refill, and color. So sensation is something that I'll also be testing moving back to Ms. Cartledge's facial area. But in grips, I'm going to have her grab both my hands and just squeeze, 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 tight as you can. So we have good grips there. And then I'm actually going to have her press her feet up against my hands. And we have good movement there. We also have assessed some of her movement and the movement of her head and range of motion. And we're going to do some continual assessments once Miss Cartledge is up out of the bed. Color, I've kind of been assessing the whole time. And again, even when I was looking at her mucosa in her mouth, looking at color, things of that nature, and all of that is good. I'm now checking for any edema, hitting I do not see, and again, get color. And then I'm going to use the back of my hand to assess temperature, which is normal. Then here, I'm going to check for capillary refill. Which the capillary refill so far is quite brisk in less than 3 seconds. All normal there. Now her pulses we've already assessed, so we're good there. And then we're going to continue with some of the movement. I'm actually going to let her down because I'm remembering we have to talk about those eyes. We talked about them a little bit. But I also need to assess her pupils. So we're going to make sure that we do that. And for that, I can lift the head of her bed up a little bit more. And as I do that, again, now that her head, even though she's not sitting straight up, is more than 30 degrees, I can look and see if she has jugular vein distension, which I do not see noted as excessive jugular vein distension, which could be associated with fluid volume overload. And working on this lovely sandwich it turns her into again. So I'm actually going to break out my pen light here. And let's look at those lovely pupils. So while it's not 20/20 vision, that is quite all right. My pen light wants to run away from me. Found it. So one of the things we'll look for when we're assessing her pupils is we'll have you just look straight ahead. And as she's looking, we can look and see. Typically, are her pupils equal? Are they round? And then the next thing we're going to look for, and I'll have you actually look straight at my nose. And just continue to look at my nose. And continue to look at my nose. And what I'm assessing for in this is to see if her pupils reacted to light, which should be that they constrict. And then I'm going to have you look at my nose again. And I'm going to have you just continue to look at this. As I bring it in. And that we're looking for accommodation to see as this pen light or particular object gets closer, her pupils should also constrict. Now another thing I'm going to assess for in her eyes is her ability to look in different directions without moving her head. So I'm going to have you actually follow the pen light and just the pen light without moving your head. And while we're doing that test, we can also look for things like nystagmus, where we're looking for jerky eye movements. It should be a smooth, continuous movement, able to look in all the different cardinal fields without turning the head. So Miss Cartledge was able to do that. Eyes did move a little, but something tells me that's not new. So no, but in that test, we're able to see that. So that was some of the things we could catch up on by actually going back and moving back up to her head. The last thing I'm going to have Miss Cartledge do is actually stand up for us, and she's going to do a little bit of walking. All right. So I'm going to adjust this just a little bit. And I'm going to have Miss Cartledge actually just walk this way, heel toe first. And you're going to turn around and walk toward the end of the bed. And if you could turn around and walk on your toes for us. And are you able to walk on your heels for us? And just walk normal for us. And with this, I'm just assessing her normal gait. All right, and the last thing I'll have you do is actually just stand there with your feet together. All right, hands at your side with Romberg's test. Just look and see if she sways at all. So with eyes open, I really don't see any swaying, any moving about, which is good. Now I'm going to ask you to close your eyes. Still assessing for the same thing, seeing if there's any movement or swaying as her eyes are closed, which I do not see. Alrighty. I'm going to have Miss Cartledge take one more seat because I thought of some more things. That head is a tricky area. So a couple things that we also could again palpate is the temporomandibular joint up here. So I'll have you open your mouth. All right. And close. And then the masseter area here, I'm just actually going to have you kind of put your teeth together really tight. And you can feel that area there. And then you can relax. And you can feel the difference in that joint. And then I'm going to have you kind of shrug your shoulders here. And one more time. Okay. Well, I think that is the end of my assessment. I'm going to take a quick look at my cards. But I think I have most of it. But I'm sure you ladies will let me know if I don't. All right. The only other things I saw on there that I will add real quick is when I was doing her abdominal assessment, I did not mention the aorta, which we can also auscultate for in her abdomen. And then when I was over her back region here, as I palpate over her back, do you have any back pain? That's also percussing and noting her kidney area. All right, Dr. Foreman and Dr. Clark, I hope I did well. Thank you. And thank you, Ms. Cartledge, for participating.
Thank you.